As healthcare costs continue to rise in Colorado, Governor Polis and some state lawmakers are taking aim at hospitals. They want to cap what hospitals can charge some insurers, saying many plans are paying 3 times what Medicare does for the same services. And it is sorely needed. In 2023, more than 1 million Coloradans could not afford necessary health care. And among those with coverage, 1 in 4 say that even with insurance, they could not afford the care that they actually needed.
Your political reporter Sean Boyd talked with the governor about that price cap. She joins us now.
And Sean, how would this work?
Well, first, it would not apply to all insurance carriers, only the state employee health plan and small group market, which covers small businesses. Instead of those plans paying 3 times what Medicare pays, they would pay about 1.5 times the Medicare rate. The savings, an estimated $50 to $60 million a year, would go to community health clinics, many of which, as I reported last month, are in danger of closing. But the Colorado Hospitals Association says dozens of hospitals are also in the red. And a price cap, it says, could be the final blow. Coloradans saw health insurance premiums jump by nearly 10% last year, and hospitals make up about half the cost of those plans. Over the last 10 years, their net revenue has doubled to nearly $22 billion, while community health clinics in Colorado are in danger of closing. Governor Polis says it's time to share the wealth.
I wish the highly profitable hospitals would look at this more holistically.
He's backing a bill that would cap what hospitals can charge the state employee health plan and small group market at about 1.5 times what Medicare pays. Small rural hospitals would be exempt. The savings would go to keep safety net providers afloat. Right now, Colorado hospitals are reimbursed on average nearly 3 times what Medicare pays for the same care.
We cannot continue to pay in excess of what is fair.
It's rate setting on hospitals, and that's a problem.
Julie Lomborg with the Colorado Hospital Association says Medicare covers about 73% on average of what it costs to provide care. She says 56% of hospitals are in the red, and they will need to make up the lost revenue somewhere.
The onus of this will be placed largely on large businesses, employers whose costs for health care and premiums will go up because the costs will be shifted.
They can say whatever they want about their bottom line and the challenges they're facing. The reality is they know that these other folks in the healthcare world are facing even greater challenges.
Lieutenant Governor Diane Primavera says everyone has to do their part.
We've turned over every rock, pulled every lever we can. It's not just trying to go after the hospitals.
The bill is expected to save the state between $50 and $60 million while cutting hospital profit margins by 0.5 percentage point.
0.5 percentage point on a hospital that's not making any money right now could be catastrophic.
The governor says it will be worse if community health clinics close.
If we don't get the preventative treatment, early diagnosis to those who are underinsured, on Medicaid, uninsured, through community health clinics like Salud and Clinica, they're going to wind up in emergency rooms, uncompensated care for the hospitals.
In addition to small rural hospitals, outpatient behavioral health services and primary care services would also be exempt from the price cap. Julie Lomborg says the Colorado Hospital Association shares the concern about community health clinics, but says a price cap isn't the answer. She plans to send lawmakers and the governor the Hospital Association's own ideas for how to save money and save those community health clinics. Oregon, Montana have enacted similar price caps, and they have, in fact, had significant savings from them.